Dr. Sierra Windsor, we had so many good questions in regards to our MCAS interviews that we did about diagnosis and lab testing and treatments that we can do. We also had a lot of questions, so we decided to make an additional video about the neurologic components that are closely tied to MCAS. Lots of questions from people about, like, what about these nervous system symptoms that we're seeing? So, questions for you in regards to this, like, do you see neurologic symptoms present in MCAS, or like, when did you start putting those pieces together in terms of your patients? Is it something that you like learned about, or is it something you just started seeing in patients?
Yes, definitely something I started seeing in patients and then prompted me to learn more about, in terms of like, is this just MCAS? Is this something else going on? But there are a lot of connections in both like literal nerve health, like, and nervous system health, like more, mental, emotional health as well.
So what types of connections were you starting to see?
Lots of things in terms of like tending towards more anxiety, which it makes sense if someone's feeling unsafe taking things and even foods. Like, that's a big part of MCAS is reacting to things. So I think it makes a lot of sense on one hand that the nervous system doesn't feel super safe. And then the more like nervous system symptoms, like lots of things like dysautonomia, changes in blood pressure and heart rate, and those kind of like come with that territory as well, and sometimes a lot of pain as well.
Okay. How do mast cells in general affect the nervous system?
It's a great question. So mast cells actually live right next to our nerves. Like, their proximity is super close.
I mean, like, that makes sense. The immune system can go anywhere.
Yeah, and how they influence each other, right? Like neuroimmunology is the next big field in medicine because those things are so tightly intertwined, like literally, and the way they interact. So you have mast cells right next to the nervous system tissue and nerves, and the mast cell mediators that happen when mast cells degranulate from all the triggers we talked about in our last videos, those tend to be very inflammatory and can even damage nerves and kind of create feedback loops.
Okay, so the mast cells can actively damage the nervous system that they're so close to in proximity. And is it a case that, is it always the mast cells that are causing the nervous system disruption, or is the nervous system disruption causing mast cell activation?
It can go either way.
Cool.
Of course. Yeah. We're very complicated.
Straightforward answer.
Everything's connected. The mast cell mediators can aggravate nerves and cause pain and neuropathy and those kind of things. And then that can also activate mast cells as well.
Cool. So it can be both.
Yeah.
And can we tell a difference between what's causing what, or is it just kind of a jumbled mess? It's hard to say.
It's a bit of a mess, but if you treat someone with, you treat their MCAS, and I'm always really curious what's going to get better or what doesn't get better, right?
So if you treat the MCAS and say the neurologic symptoms get better, then chances are good that's the MCAS that's creating those symptoms. If you treat it, maybe they don't. Maybe those other neurologic symptoms came first.
And if there's a self-fulfilling prophecy happening, we have to jump in that loop somewhere to try and start stopping that loop from happening.
Yeah. What are some common neurologic symptoms you see with MCAS patients?
Big one that I've been learning more about recently is small fiber neuropathy, which can present with a lot of...
this has been coming up so much
It
recently.
has been coming up a lot. There's a lot of questions about small fiber neuropathy.
Yeah.
It's been so on our minds recently.
I know, which is another really challenging condition to diagnose because there's not a lot of good testing for that either.
Yeah, besides like a biopsy.
Yes. You got to make sure you get it in the right spot. Yeah.
So basically the small fiber is responsible for like temperature and light touch and sometimes, like pain. Those can get damaged from the mast cell mediators, or they're inflamed and damaged. And so that can present with lots of numbness, tingling, burning. Sometimes it can even be sharp, stabby type pain. Oftentimes it's in the extremities, but can happen other places too. And I was reading a really interesting study. It's a really small sample size, but I still think it's interesting. They found like 80% of people with MCAS or hereditary alpha tryptosemia, which, you can have both, but they kind of go in the same category. Mast cell degranulation. 80% of them had small fiber neuropathy confirmed on biopsy, which is, I didn't realize it was that high.
Yeah, that's a huge number. And especially since small fiber neuropathy is one of those things that is like harder to diagnose. Maybe there's a lot more people walking around that have small fiber neuropathy and they don't know. Yeah. What other kinds of neurologic symptoms do you see?
The dysautonomia is a huge, huge part of MCAS.
Right, so define dysautonomia.
Good question.
Because there's a lot of terms for this.
There are, yes, there are. So it's dysregulation of the autonomic nervous system, which is largely our fight or flight and rest and digest, so sympathetic and parasympathetic balance. So the things that we don't really think about, like breathing and heart rate and blood pressure, that your body just automatically regulates using these two branches of the nervous system. So a little different than like our pain and temperature and touch kind of feel. But those are always working in the background.
Yeah.
And this is where the real vicious loop comes in, because the mast cell mediators cause things like vasodilation, like they cause plummets in blood pressure, and they cause like symptoms in which then your body uses the sympathetic branch of the autonomic nervous system to try and compensate for that histamine response. And in doing so, now you have a lot of sympathetic activity, which then can also trigger mast cells. So mast cells have receptors for excitatory neurotransmitters on them. So things like
Of course they do.
norepinephrine. Of course they do. So you have an increased sympathetic response, and then those neurotransmitters do their job at trying to regulate your vitals, basically, and then they also can trigger mast cell degranulation.
So then you might get symptoms like elevated heart rate
Yes,
and dizziness.
Or the classic standing kind of like feeling like you're going to fall over. It takes your body a couple seconds to like regulate things.
Yeah, like you're not able to kind of compensate for those changes in position.
Yeah.
Yeah, okay. Any other neurologic symptoms you'll see? Like, what about headaches or migraines or?
Yes, yeah, migraines. Whenever anybody has migraines, MCAS or not, I'm always looking for a histamine component. I find it's, if that makes a big difference, like what an easy thing to do for people instead of like all these other medications.
Yeah, like putting them through the gamut of migraine medications.
And trialing and failing all those things. Yeah. So I always look for a histamine component, especially if it's like menstrual migraines, like they get at the same time in their cycle. That's really interesting in terms of histamine. So yeah, definitely I put headaches and migraines in that list as well.
Because there's also a hormonal component to the mast cell activation, huh?
Yes.
Which we should maybe do another video on.
That could be a whole video.
That could be a whole video. Okay. Any other common neurologic symptoms that you'll see?
Yes. I mean, in terms of like more of the sensation of anxiety, like anxiety can encompass so many, I guess the nervous system activation, like not just anxiety, but the activation, excitatoriness of it. Histamine is an excitatory neurotransmitter, and it can, like we have histamine receptors in our brain, in our central nervous tissue. So that's important to realize, but also they've correlated. So histamine itself doesn't cross the blood-brain barrier super easily because it's a big molecule. But all the other mast cell mediators, they do increase the permeability of the blood-brain membrane or the barrier. So kind of think of like, leaky gut, leaky brain, and how we've connected those two things as well is really interesting.
That is interesting.
Yeah, so it increases in neural inflammation.
Yeah, and I think you'd mentioned mental health too, right? Like there's the activation of mast cells can change people's mental health in general. And are there connections between certain types of disorders, mental health disorders, and MCAS?
There are. It's like it's a whole world of things, but I'm always just really surprised. Example, like PMDD, I've had great success with using mast cell stabilizing techniques. I think a lot of anxiety and depression may have a component. You just kind of have to suss out whether that's true. I've had some patients that think they might have a certain diagnosis, and it turns out like, oh, actually all the symptoms got better with MCAS treatment. So okay, is that true, or was there's nuance there, I guess.
Yeah, interesting. That's really fascinating. Okay. What about like brain fog? Like this is a really common thing that people see. Is that something that can be triggered by MCAS?
Definitely. Through many different pathways we just mentioned, like neural inflammation is a huge one. So if you're having that leaky blood-brain barrier and inflammatory cytokines and these mast cell mediators are sneaking through when they shouldn't be, like that can cause a lot of brain fog. And also when you think about orthostatic vitals and things like POTS and dysautonomia, like if you're not getting adequate blood flow to your brain, like that tends to make people not think super well either. Turns out.
Turns out when you don't have blood flow to your brain, you can't think very well. Yeah, that makes a lot of sense. All right. So we talked a little bit about the dysautonomia, we talked about the POTS, and so there are a lot of people, POTS is like a really common condition that's talked about, can be caused by MCAS, and can dysautonomia or something like POTS cause mast cell activation?
It can. Actually, in some cases, the orthostatic changes can be a trigger for degranulating mast cells, which is super not cool.
Yeah, of course. Of course. How often can people potentially be misdiagnosed with these neurologic conditions before they get a diagnosis of MCAS?
Oof. Imagine all the time.
Mm-hmm.
I mean, all my patients come to me with lots of diagnoses, with lots of medications, or tried and failed lots of things. So I think I don't know exactly how long, but I imagine it's a bit.
I imagine it's probably like autoimmune diseases where it like takes 5 to 10 years to like really get a good diagnosis and treatment on board, which sucks. I wish that time was like much shorter.
Yeah.
Okay. Is there any like specific workup you'd suggest if someone is having these, apart from some of the stuff we talked about before, just like basic laboratory testing?
Yeah, I mean, the MCAS labs can be insightful. I was reading another study that said some people with orthostatic changes will have an increase in some of those mast cell mediators, which is fascinating. I've never thought to like have someone lay down and test them and then have them
like draw their blood as soon as they sit up.
Crazy. I know. I was like, that's a fascinating idea.
Huh, that is a fascinating idea. Just like stick an IV in them and like draw their blood as soon as they stand.
Interesting idea.
Yeah.
I mean, you can test for dysautonomia or things like POTS with tilt table testing is really hard to get. It's done by neurologists. You mostly, primarily, many of them don't do it. There's one in Seattle that does it, and good luck getting in.
Oh, I know. And I've had people who get scheduled and they get canceled and they can't get back in for like months.
Yeah. So it's limited.
Okay.
You can do what's called the poor man's tilt table test, which is called an acetylene test, which was invented for astronauts, which is kind of cool. And you can do that in office. It's pretty easy to do. You just take the
Takes a while.
Yeah. But it's better than nothing.
It's true. Yeah. Okay. So this is really helpful, and I think maybe we'll do another one on hormones or some other ideas. If people have thoughts or ideas of things that like they want to know about MCAS or related conditions, let us know, because we take all those comments in the chat and then we make these videos out of them. So thank you for coming. I'm so happy to have these conversations with you. It's been super fun.
Me too.